Hi, I am going to start my lecture on OB emergencies, and it will probably be very helpful if you followed along with the slideshow that I made on PowerPoint, which should be attached. So following along with my slideshow, basically the things I'm going to go over are ectopic pregnancy, abruptia placenta, placenta previa, preeclampsia, and then eclampsia as well. Let's start with talking about ectopic pregnancy. Ectopic pregnancy is when the fertilized egg implants itself outside of the uterus, usually in the fallopian tubes, which can, as it grows, stretch the tubes and cause pain to start occurring, and eventually it can rupture the fallopian tubes and cause vaginal bleeding as well as severe pain, usually up in the lower abdominal cavity. Usually it's only about 2% of all pregnancies in the U.S., but risk factors for ectopic pregnancy can include anything that has caused scarring or inflammation to the pelvis, which can be anything from past surgeries, from like getting polyps removed, to even like a pelvic inflammatory disease or something like that. The rupture usually happens between the 5th. Usually it's a sudden onset of the sharp pain or the vaginal bleeding as well. And you should suspect this in any woman that's of childbearing age, so anyone from pre-adolescence all the way to like 50. They're all in there. It is a life-threatening emergency. When you are transporting these patients, be sure to closely monitor them because they are bleeding and they can go into hemorrhagic shock. And if that happens and you're monitoring it, be sure to treat it aggressively. You can start 2 large bore IVs, or if it gets really bad, you can place the patient in a supine position if that's your last ditch effort. You do want to transport them pretty immediately. Go to the nearest facility you can that has surgical capabilities, because they're going to have to go in there and fix the problem. The next OB emergency that I'm going to talk about is abruptia placenta, also called placental abruption. It's when the placenta separates from the uterus wall, which is where it's normally attached, and bleeding starts happening where it's separated, and it can get stuck in this little pocket in there, or it can leak through. And some risk factors for this one are getting in any kind of trauma with the abdomen when you are pregnant, if you have high blood pressure, cocaine or tobacco use, or if you're just not eating right when you are with child. It is a really painful thing to happen. It's described as really painful from the woman's point of view, and there's like really sharp contractions. There's a dark blood that comes out from vaginal bleeding. It could be a lot of blood, it could be a little bit of blood, it just depends on whether or not it gets trapped in that little place where it gets separated. Normally there's an increase in the amount of blood in your body when you are pregnant, so that kind of pads the mom at first for hemorrhagic shock, but if she doesn't catch it soon enough, or if she just doesn't notice it right away, it could get to the point where it can become hemorrhagic shock, and then you need to again treat that shock as you would, start IVs, you have fluids. Usually this kind of stuff happens in the 3rd trimester, and if it's pretty bad, the uterus will be tender and board-like. But put the patient in the left lateral recumbent position when you're transporting them. It could help with some of the pain with the contractions. And again, transport to a facility where they can do surgery. And in this case, they're going to need a C-section. The next thing I'm going to talk about is placenta previa, which is the abdominal placement of the placenta that can partly cover or completely cover the cervix. It happens in 1 in 300 pregnancies, and a lot of the risk factors include having a previous C-section, being an older person carrying a kid, preterm births, if you have a history of it, it could happen again. All types like that. So basically what happens is when the cervix starts to dilate during labor, the placenta separates at the edge of the cervix, and usually the woman doesn't know that this happens. It doesn't hurt, it's painless, but there is a lot of bright red blood that happens, and there's little to no contractions. And again, this happens in the 3rd trimester. And with that, placental insufficiency can become a problem. The baby's not getting blood flow to them, and it can make the fetus become hypoxic, and it could be very, very dangerous for the kid. So when you're with a patient like this, be sure to closely monitor them for shock, because they are bleeding pretty good. It is important to never pack the vagina with gauze or bandages, but just if you need to, use towels, a pad, loosely pack it only. Never, 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 ever pack the vagina. And transport, again, to a facility that has OB capabilities. So that is something they're going to have to surgically fix. And the last thing I'm going to talk about is preeclampsia and eclampsia, which is basically pregnancy-induced hypertension. They're not quite sure what the reasoning behind it for is, but they think that it's an abnormal blood vessel constriction, which leads to complications after about 20 weeks of pregnancy. Some risk factors in this can include anything from being obese, having renal failure, diabetes, being an older mom, anything that could raise your blood pressure while you're pregnant could be risk factors in this. Some signs and symptoms you'll see with eclampsia and preeclampsia. They'll have headaches, they'll have swelling of their hands, feet, and face. They can have pain in the upper right quadrant of their abdomen, and epigastric pain. More nausea and vomiting than usual. They can see hallucinations, visual disturbances. They can start getting protein in their urine. And basically that all is preeclampsia, and once it can progress to seizure-like activity, which in that case it becomes eclampsia. The seizures can be really dangerous, and they can cause anything from like placental abruption to making the baby become hypoxic, or even the mom hypoxic, neurologic damage. There's a lot that can go wrong with seizures in pregnancy. Other problems that can arise out of preeclampsia, or if it does progress to eclampsia, it can be a stroke. You can start having blood clotting problems, your kidney or liver could fail, and you could even die. So it's kind of a big deal. Any blood pressure above 140/90 when you're pregnant is considered preeclampsia. It is normal for a patient to have 20 above diastolic and 10 above systolic, or that's the other way around. 20 systolic, 10 diastolic from their normal baseline, but anything above that is considered preeclampsia, and they're going to start taking precautions for that. And usually they'll know that. Usually the doctor will let them know that this is going on, but one thing you can do when you're transporting is to put them on their left side and take them to a place which, again, has OB capabilities. If they do become epileptic or have seizures, the most important thing to do is to treat it like you would treat any other seizure. Manage their airway, give them oxygen, start IVs. One thing to actually try with pregnant ladies is to use magnesium sulfate, and you dilute it in 100 milliliters of dextrose 5% in water. It can have better effects for the baby and the mom, but it can also, they can become hypermagnesium, and then you're going to need calcium gluconate to counteract that. And if that doesn't work, you can use things like Versed and stuff like that to stop the seizures. So overall, I talked about OB emergencies, I talked about the signs and symptoms of ectopic pregnancy, abruption of placenta, placenta previa, and preeclampsia. We talked about how to treat them and transport all of those. In summary, OB emergencies can be really life-threatening for both the mom and the kids, so act accordingly. And if a girl is of childbearing age and having abdominal pain, it's not wrong to go straight to that if the symptoms are presenting. So hopefully you enjoyed my lecture. If you have any questions, comments, concerns, let me know. Look forward to hearing your feedback, and see you next time.